starting with ACS-1, use of the word forced. And this is use of the word forced in any context by anybody. Okay? Just the word forced shows up in the data set. Why is that an associated clinical sign? For two reasons. One, it is a symptom feature of the transgenerational transmission of trauma, and specifically sex abuse trauma. That's the one we're worried about over here, is the transgenerational transmission of sex abuse trauma. And that is a characteristic internal working model or schema of that type of pathology, that the child was forced to do something against the child's will. You don't find that with physical abuse. You don't find that with ADHD or autism or oppositional defiant disorder anywhere. If you were to take a control group of, let's say, kids out of school system who are getting in trouble with school problems or something, getting referred to the school counselor, and you would look at all the data around these kids, you will not find the use of the word forced. You won't find teachers saying the child should be forced to do their homework or the child shouldn't be forced to come to school. No, they don't even use that word. They say the child needs to do their homework. The child needs to come to school. They don't use the word forced. That the use of that word is an indicator of sensitivity to the child being compelled to do something against their will. We compel children to do stuff against their will all the time. Get dressed, take a shower, get off the video games, go to school, do your homework. That's just forcing kids to do stuff that they don't want to do is common. It's the professional word for that is called parenting. Okay. The fact that somebody brings that up, that the child shouldn't be forced to go on visitations with the other parent, or the child shouldn't be forced to, do things, take phone calls or things. Any use of the word forced indicates a sensitivity, and that's the transgenerational trauma sensitivity. The other reason that it is an associated clinical sign and shows up is because it is highly manipulative. That's the Machiavellian level of the manipulation on ACS-1, because using the word forced implies that there's something bad that the other parent is doing. Because if that was a good parent, we wouldn't have to force the child to be with a good parent who the child loves and stuff. So by implication, just simply using the word forced implies that it's something bad. There's something bad that the other parent's doing. No, they're not. We're not forcing the child to be with that parent. We are giving the child the opportunity to bond to both parents. That's the authentic framing of things. And so that use of the word forced is a manipulative way to get people to back off. Oh, we don't want to force a child to be with that parent. And then they back off. Well, is there something bad with that parent? And what's going on? And it gets us backed off of treatment that says the treatment you need to go be with your parent because that's what the court order says. That's what treatment says, or no problem. But no, wait, you don't want to force the child to do that. We want the child to cooperate. So it's a highly manipulative use of that term. And so that's where that shows up. And in the CRM data, the prevalence of ACS-1 is 85%. 85%, the ACS-1 shows up in 85% of the families. Now, ACS-1 and 2 also go together. That's why I put ACS-1 first, because it's a useful tell on the pathology. When you're reading a document and, a declaration by the allied parent, and the parent uses that phrase, the child shouldn't be forced to go on visitations with, or that we shouldn't force the child, click. That should be a trigger to kind of pay attention. It's not diagnostic, but it's something to listen for. And so I put that as number one, and I use number 2 because these two go together. Number 2 is empowering the child to reject the other parent. So the sentences you will hear put together are, the child shouldn't be forced to go with the other parent. The child should be allowed to decide on visitations. So you see how they kind of go together. One is it takes away our ability to compel the child and to take leadership of the child. It puts the child in charge. We shouldn't force a child, implies there's something bad going on, and then empowers the child to reject the other parent. What happens there is the pathological, narcissistic, borderline dark parent first psychologically controls the child, gets the child in this enmeshed cross-generational coalition. And once they have manipulated the child onto their side in the spousal conflict, then that's the force. We shouldn't force the child. The child's over on our side now. That then they empower the child's voice to reject the other parent, and they just hide behind the child and say, "It's not me, it's the child who is rejecting. What can I do? I can't force the child to take phone calls from the other parent." The child should be allowed to decide, how much contact they have with that other parent.